Are you thinking about your dream smile while exploring paradise? Discover why Costa Rica is the ultimate hotspot for affordable, high quality dental care and how it could save you thousands. Literally, it can save you between 50 to 70% on dental implants when compared to the US or Canada. So today, guys, I'm responding to a video by Stephanie Perry who had a root canal done in Costa Rica. Now, she tagged me in the video. Thank you, Stephanie. And I'm actually responding. So I'll place a link to her video in the description in case you want to give it a watch. But there are some important reasons to explore medical tourism. Now, I like to sum it up as what I coined as the three A's of medical tourism: accessibility, availability, and affordability. So people usually engage in any type of medical tourism for accessibility, for issues like maybe insufficient or no healthcare insurance coverage, things like healthcare staffing shortages, or for us, Black women, things like stigma and bias. They exist across the medical community, including discrimination based on race, immigration status, gender, sexual orientation, transportation and work related barriers. All of these things, even patient cultural barriers like language or religious barriers, actually play a role in accessibility of health services. As far as availability, think about things like how long it actually takes to get an appointment. Sometimes you have a waiting list and you can't get in to be seen, and it's something that you need to be seen for pretty quickly. So, lack of that, or maybe lack of focus on preventive care and wellness, which is typical in the US. The US tends to have a more disease management approach rather than preventive medicine. And then affordability, obviously, the cost of healthcare in the US is astronomical. And with medical tourism, Americans can save anywhere from 30 to even upwards of 90%, depending on where you go and what you're having done. All right, so let's get into Stephanie's video. So Stephanie actually shared that she had two root canals and crowns and one filling that was done in San Jose, Costa Rica. San Jose is the capital of Costa Rica, so keep that in mind because sometimes things cost a little bit more in the capital or metropolitan cities than they do, say, in the suburbs or in rural areas. But it also plays a role in technology. A lot of times, those that are in the capital have a lot more technology and innovative things that are available. So it's up to you to kind of do your research to determine what would work best for you for your situation. Now, she actually had her root canals done in 2023, in October 2023, but she just recorded the video of a follow up in September 2024, and she revealed there were no problems whatsoever. Things have been going really well. Now, she also shared that she Googled best endodontist in Costa Rica, and she selected the top one, which happened to be very close in proximity to her location where she was staying. And also, they had English speaking dentists, which was obviously helpful to her to maneuver around what she needed. She also shared that WhatsApp was used to communicate directly with the dentist, and that it was a surprise to her that they actually, they advised her even to take a picture of the tooth after she was communicating with them about what the issue was. And the endodontist shared that she should come in. She went in, they were not there daily. So she went in for the first week, which was more like a consultation. And she went in for that exam where they kind of assessed her. And then they determined that she would have to come back and the endodontist would start the procedure the following week, which was done. And they also did a series of x-rays, and they also consulted with other dentists in the office to determine her course of treatment and finalize everything that she needed. So it was a pretty straightforward process. What she mentioned that was really key, because a lot of times when people think of medical tourism, there's pros and cons with everything, but a lot of times people wonder about the quality of care. Well, she expressed that it was gentler, kinder, and warmer in terms of the care that she was provided with in Costa Rica than any care she's received or experienced in the US. She said in the US, a lot of procedures are not necessarily done with a lot of care. They make assumptions based on her being a Black woman, things pertaining to pain. They tend to ignore her. She said in Costa Rica, the procedure was done with lots of care and lots of communication, them speaking with her, asking if she's okay throughout the entire procedure. She stated that she would also return to the same dentist for future work work because of the quality care she received. So that speaks to the quality of the work. Additionally, she mentioned pain control was well managed. She said there was no issue with them providing more anesthesia as needed because there was one tooth that was a little bit more tender than the others, and they continued to add more and more anesthesia. And she said in the US, many Black women experience racial biases and discrimination from clinicians, or just have a sense of being ignored when we indicate that we're in pain, or we're given a minimal amount of pain medicine that is not in line with the correct level of pain we've expressed that we're experiencing. So it's good to see that Stephanie had a positive experience. She also mentioned that she got zirconium crowns. Now, for those that don't know, zirconium crowns usually last anywhere from 10 to 15 years. And data indicates that they can last even longer when you take care of them, obviously, brush, floss, rinse, and keep your twice yearly dental appointments. Now, Stephanie says she wasn't sharing the name of the dentist office because she didn't do any research. She just Googled. And I have to tell you, I actually appreciate that because the onus is on you guys. You need to do your own research to determine what works best for you and your situation. I always encourage you all to do your own research. We can all have a PhD in Google, and it can start with the Joint Commission International. And I left a link in the description for you guys, but that's essentially a branch of an accrediting body where they go through and do assessments in the United States, but also the international branch does accreditation for any healthcare facilities outside the US, where they are essentially the gold standard for quality of care and for safety. Okay. So also, it's important that you guys read patient reviews and testimonials on websites, and also look at social media platforms specific to the country or the city where you plan on receiving your care. People are always willing to share referrals and their experiences, whether they're good or bad, they're always willing to share them. Okay. You can also consult with a medical tourism facilitator who can vet clinicians and facilities and can help set all of this up for you for a fee. I left a link also in the description to a video where I interviewed two medical tourism facilitators, and you can certainly contact them on your own and get a free consultation if you decide to move forward with a medical tourism facilitator instead of doing all the research on your own. Okay. Lastly, pertaining to Stephanie's video, she mentioned she paid $825 per tooth and she didn't bargain with them. Now, she mentioned she can get cheaper than, well, that's obviously cheaper than the US. That goes without saying, okay? But she mentioned that she could have even probably gotten it cheaper if she decided to explore additional options, but she didn't want to do that. She knew she wanted to do it very quickly and do it close to where she was located. Now, usually, as I mentioned, the capital cities, again, they typically are a bit more expensive, not too much more expensive, but they are. One of the things I will tell you is that for the cost of Stephanie's root canals for Costa Rica, that is pretty affordable, the $825 per tooth. Now, for some other dental procedures like dental implants in Costa Rica, they can start around 750 US dollars. Now, if you compare that to the hefty starting price in the US, which is about $3,000 to $5,000 price tag for a single dental implant in the US, obviously the savings are clear, right? So, some of the other procedures, a full mouth rehabilitation in Costa Rica, that can cost between $10,000 and $22,000 for both arches. Okay. It's more economical than the US, where you'd end up paying, where you'd start at the 22 grand mark, 22,000 all the way upwards to even $80,000 if you were to do the same full mouth rehabilitation for both arches. So the thing that you have to consider, though, is the exact pricing depends on the clinic and the number of teeth that need replacement. So keep that in mind. Okay. Also, if you're looking for something like maybe porcelain veneers, those types of things, if you were to do individual porcelain veneers, they call it per unit, essentially that would start at around $450 in Costa Rica. To compare, in the US, one unit of porcelain veneers would start around $2,500. If you were getting a set of porcelain veneers, that would start in Costa Rica at 5,400, and the starting price in the US would be 30,000. So this is worth exploring medical tourism. And I want you to think about why Costa Rica is even becoming a popular destination for people that are seeking medical, dental, or even cosmetic treatments outside of the US. Well, I'll tell you that this includes literally about 74 million Americans actually travel to Costa Rica and Central America for other procedures, dental coverage in particular, because there's quality dental work and they don't have any dental coverage in the US. So it's worth it. Now, if you're in need of dental work, you may be considering dental tourism, and Costa Rica should be at the top of your list because Costa Rica is a popular destination for medical tourism in general. And the primary forms of medical tourism in Costa Rica are dentistry and cosmetic procedures. So, dental tourism alone actually represents 40% of all medical tourists coming to Costa Rica annually. Right now, it's also popular because Costa Rica in general is a safe country. And that's both on the political side, it's very stable and it's safe, and economically, it's stable. Okay. It's close to the US, so there's a lot of convenience there. You know, there are direct flights coming in and out of Costa Rica daily, so that's not an issue. But also, the standard of care in Costa Rica is very high. The World Health Organization actually notes that Costa Rica has a higher life expectancy than in the US. And the World Health Organization's 21st Century Healthcare System rankings, they rank Costa Rica as 36th in terms of health system performance, while the US is actually ranked at 37 behind them. So, and the healthcare system in Costa Rica, it's frequently cited as one of the best in the world. I mean, the United Nations actually places Costa Rica's healthcare within the top 20 in the world. So there's a lot that is there for you to select from, whether it's dental tourism or medical tourism in general. So, since we're talking about dental tourism in Costa Rica, one of the things that I want to share with you is essentially the popular choice for patients seeking high quality care at a lower cost. Obviously, includes the cost, which I'll get to a little bit more of that also, but quality. You know, I don't want you guys thinking that because it's a another country that the quality of care is not there. Costa Rica's dental clinics use modern facilities, advanced technology, and quality materials. And they also adhere to strict standards and regulations that are set by their own Costa Rican Dental Association. Okay. Convenience is another reason people will travel for dental tourism to Costa Rica. So, Costa Rica's central location and their excellent transportation infrastructure actually makes it easier for travelers from North America to get there. So, it's very convenient. And then language assistance. Usually, there are not many language barriers when you're dealing with Costa Rica because many dental clinics in Costa Rica have bilingual staff who can assist with English. So, it's not an issue. Um, Add to that warm hospitality, as Stephanie mentioned. You know, Costa Ricans are known for their warm and friendly hospitality and living the pure life, pura vida. Okay, so that's something that goes without saying. You will not have any issues pertaining to that. Now, going back to cost, dental work in Costa Rica, as I mentioned, it can range depending on what you're getting to being 80 up to 80% less expensive than in the US and even in Canada. So, one of the things I wanted to talk to you guys about was packages. So there are some dental clinics in Costa Rica that offer packages that include elective dental treatments and procedures. So you can have something like a full mouth restoration, you can have a smile makeover, the porcelain veneers, all of those things. So while dental tourism in Costa Rica is generally safe, it's actually important to make sure that you're aware of the average rate for dental work if you want to make sure you go ahead and avoid dentists that charge much less than others. Okay. Make sure you're looking at that because you get what you pay for. The good news is medical and dental service rates are actually regulated in Costa Rica. So that's a plus. You know, the National College of Dental Surgeons in Costa Rica provides a recommended rate for every service. And this represents the minimum rate. So, although some dentists will charge a bit more, most will still remain very close to the recommended rate in order to be competitive. Now, don't go to a dentist that charges far less than others. I'm warning you. Okay. You get what you pay for. I'm just putting that out there, making sure that you understand that. Um, Now, don't think that you're limited either with the type of dental services that you can obtain in Costa Rica. Any dental work that you can have done in the US is also provided in Costa Rica. You can go to Costa Rica for whitening, you can go for cavity procedures. Dentists in Costa Rica can also provide dental implants, the crowns, oral surgery, orthodontics, full mouth restoration, even pediatric dentistry, endodontics, and more. So you have a plethora of things to choose from. Now, when you're looking for specialty work, one of the things that's a plus is that you can check colegiodentistas.org. And I put a link in the description. That's basically for you to see if your dentist in Costa Rica is trained and certified to perform the work that you're looking for. And it ensures that a qualified professional can actually practice the dental work that you desire. So you have the JCI, the Joint Commission International. I also put colegiodentistas.org, which is amazing because it's a local site where the government has put that together for you to essentially locate whether your dentist is actually trained and certified in whatever it is you're looking for. You can also check for license and certification. So all dentists in Costa Rica attend college for 5 years. They're also licensed by the National College of Dental Surgeons. Excuse my voice, guys. I'm just getting over the flu and bronchitis. So, yeah. Anyway, again, you can check to see on colegiodentistas.org if the dentist actually has a valid license. So you're checking for everything, accreditation, training, and their licenses, and if it's up to date on that one site. So you're killing more than two birds with one stone. Additionally, there's something called ProMed. And a ProMed seal on a dental clinic signifies a certification from the Costa Rican Health Chamber. What that does is it tells you whether they're certified to offer treatment to national and international patients. So you have even more cushion there to ensure that you are getting quality care. Now, some of the things I want you to keep in mind in order to avoid some common risks, I want you to first always check that your dentist is licensed using that website that I provided. If you're going for specialty work, ensure that your dentist is qualified to perform that work. Also, check the dentist's reviews online. You know, reviews can tell you a lot about their customer service, the quality of their work, the atmosphere in their office, their staff, the longevity of their work as well. You want to make sure that the work is maintained over time. But don't travel if you have medical conditions that are not under control. I want to make sure I stress that. So you're thinking about all the dental work, but if you have any pre-existing conditions, you need to be mindful of that. So you should talk to your doctor about any risks that are involved. Let them know when you plan to travel and where you plan on traveling to. It's really important because, one, if you have a condition that's not under control, you're going to want to get that under control before you undergo any dental work, right? That's one piece. The other piece is if you're traveling, and more than likely it would be by plane, altitude can exacerbate health issues, including dental issues. So you want to make sure that you're cleared, you have a clear bill of health before you travel anywhere. Okay. It's also a good idea to bring a copy of your medical and dental records. Your dentist can review these ahead of your treatment for any possible complications or risks, and also include any prescriptions that you have and a list of any medicines. And this includes over the counter and vitamins. It includes eye drops. It includes skin creams that you're currently taking. There are some vitamins and some over the counter medicines that can cause thinning of the blood. Even something as simple as garlic or ginkgo biloba, aspirin, Motrin, those types of things. You just want to make sure you're divulging as much information as possible. It's better to overshare than to undershare. Okay. Now, if you decide to book your dental tourism through an agency, maybe a medical tourism facilitator, have an agreement in writing. Okay. The agreement should outline what treatment you're receiving, what supplies you're provided with, and the extent of care that's actually covered by your payment, including consultations and your follow up care. Sometimes, guys, you may have follow up care, and you want to make sure that the follow up care is actually done by either the same dentist or the group that they're in the same facility. Because if they don't do it, then you'll have to spend time going to another facility, spending money with another facility. You want to make sure everything is in house so you're not going around in the midst of you being treated. Okay. Also, to avoid miscommunication in countries where you don't speak the common language, just ensure you know how you're going to communicate with the dentist. And again, Costa Rica should not be an issue. Many of the dentists and clinicians are bilingual, they speak English and Spanish. Make sure you get a copy of your treatment records once you're done from your dentist. Have them include any information about any follow-up treatment and or any medications you've been prescribed. And also ask, it's worth a try to ask if they can have your records in English. If not, you can Google any translation companies that do medical translations, and they can go ahead and transcribe that for you if you decide to keep that in English, maybe for a provider in your home country, whether you're in the States or somewhere else. Okay. Now, dental tourism in Costa Rica is increasingly popular for a reason, all of those that I've shared so far. But with the high quality of care and the low cost, and of course, the beautiful scenery, Costa Rica is a perfect place to have dental work done while enjoying a vacation. So make a vacation out of it. Make it true medical tourism, guys. If you visited Costa Rica for dental tourism or any type of medical tourism, let me know in the comments about your experience. And until next time, be well.